Dr. Mendoza is an assistant professor at the Cancer Prevention and Cancer Program at Georgetown Lombardi Comprehensive Cancer Center. She is a bilingual social psychologist with an interdisciplinary training in anthropology and communication, culture, and technology. She aims to combine interdisciplinary approaches in social psychology, behavioral science, and communication to develop and evaluate interventions that address stark disparities in the uptake of genetic risk assessment in high-risk underserved groups. Her research focuses on traditional genomics with underserved populations. Dr. Hurtado, please, you can take the podium, virtual podium.
Thank you so much for the introduction, and it is my pleasure to be here to share the research that we have been conducted in partnership with community-based organizations. As Florencia was mentioning, there has been a low participation of Black, Asian, and Latinx communities in clinical trials. Recent studies have shown that only 31% of trials report race and ethnicity, and that the participation of minorities in the past 14 years has even been slower compared to historical data. You can see it in this chart, how most of the research participants are non-Hispanic whites with very low representation of African-American, Hispanic, and Asian populations. And it is really important for minorities to participate in research and clinical trials to make sure that advances in science can be beneficial to everyone and to reduce disparities. And today I'm going to be presenting two studies in which we collaborated with community organizations, and we capture all the community voices in order to develop culturally targeted interventions to reduce disparities among Latina women around genetic counseling and testing participation. If you can go to the next slide. So today we're going to be talking about screening for hereditary breast and ovarian cancer, which is a topic that is less known. And we know that approximately 5 to 10% of all breast cancers are hereditary. BRCA1 and 2 are the best known mutations, but there have been other mutations that increase the risk of breast and ovarian cancers, as well as other cancers like pancreatic and prostate. So there's national guidelines that recommend referral to genetic counseling and testing for individuals who are at risk. This entails going to a genetic counselor who is a specialist in genetics, in which they evaluate personal history of cancer, family history, talk about testing, potential results, risk management strategies. Then the individuals decide whether they want to do or not genetic testing, which is a blood or saliva test, send the results to a lab, and then the results come back in around 3 weeks. And then you meet again the genetic counselor to discuss about what the results mean, what it entails, what is the impact, and what are the potential risk management strategies. So you can imagine that having this information can be life-saving, because there are risk prevention, risk management decisions to make that can greatly reduce the risk of cancer. However, minorities have had a very low participation in genetic counseling and testing when compared to non-Hispanic whites. You can go please to the next slide. There are many barriers to participate in genetic counseling and testing for minorities, and those include healthcare system barriers such as high cost, insurance, suboptimal referrals, or doctors not discussing with minorities as much as they do with non-Hispanic whites about genetic counseling and testing. There's been also other psychosocial barriers like having low health literacy, low awareness, low knowledge, stigma around cancer, limited communication among family members, medical mistrust, fatalism. But you can see here to the right in this bar chart, this was a study conducted, a survey conducted 3 times over a decade. And you can see that the levels of awareness from Blacks and Hispanics is lower compared to non-Hispanic whites. And that difference doesn't really change throughout this time period. You can go to the next slide. So with this in mind, in our team, we decided to develop an intervention that was culturally targeted for Latinas to increase the level of awareness, knowledge, and use of genetic counseling and testing. And we did that in collaboration with our community partners, which were Nueva Vida, Capital Breast Cancer Center, and we also engaged the National Conservatory of Dramatic Arts, since the goal was to develop a video that was telenovela style so that it could resonate with the study participants. You can go to the next slide. Thank you. We did a very extensive formative work because it's very important to know what people know about the topic, what are their needs, and what are their suggestions before you actually make an intervention. So we interviewed providers, 20 providers who were mainly genetic counselors, but also patient navigators, psychologists, geneticists. And we asked them about what would be the key messages that we need to convey in relation to counseling and testing, what were their experiences providing services to Latinas, and their perceived barriers and facilitators for them to use the services. We also asked them about suggestions for making the video. You can go to the next slide. We also interviewed 20 at-risk Latina women, and those included women with and without cancer, and they all met guidelines to have been referred to counseling and testing, but you can see to the right in the bar chart how a very few of these women had actually received genetic counseling. 70% of those who had cancer had received testing, but you can see that they received testing without counseling. So they missed really important information to understand the test results. We also asked them about what was their awareness about hereditary cancer, knowledge, what were the barriers, facilitators, and also what were their suggestions on how to make the video. You can go to the next slide. We found that the main motivator for women to participate in counseling and testing was not only obtaining information for themselves, for risk reduction, for treatment, but it was mostly to help family members, because this information is not only relevant for themselves, but also for their relatives. Some of the barriers, as we already saw, included very low knowledge and very low awareness about the services, especially some were aware about testing, but really none had ever heard about what was genetic counseling. In addition to fears about cost and insurance and limited communication, we also found some knowledge gaps. For example, women had a general notion about hereditary, but they didn't know that age at diagnosis was one of the main risk factors. They also thought that the genetic testing could be repeated and you would obtain a different result, or that a positive genetic testing result would mean that you have cancer. So those were some misconceptions that we found. Another one was that women thought that the pap smear, which is a screening test for cervical cancer, they thought that it was also a screening test for ovarian cancer. And unfortunately, there's not effective ovarian cancer test. So that's why it's so important to participate in counseling and testing. The other thing we found was that the word mutation, that is a very important word used in the field, was very unfamiliar, and women interpreted it as mutilation because it's a similar word in Spanish, like similar to English, or also they interpreted it as metastasis or mastectomy. And they also thought that it was only passed through the mother's side. So all this information was very helpful for us in informing how to develop the video and what words to use and not to use when we did the video. If you can go to the next screen. Thank you. So we use all this information that we learned from the providers, from the patients. We contacted the National Conservatory of Dramatic Arts because we wanted to make a telenovela style of intervention that was engaging. So they were the one helping us to develop the script and also to filming the video. And we administered the video with 40 participants. So they answered some surveys, then they watched the video, and then they answered surveys again, and then we refer them to genetic counseling and testing. You can see this is the characteristics of the sample. Women in the sample had low education, low income. They were mostly uninsured, mostly unaffected, so they were not diagnosed with cancer. They had very low awareness about genetic counseling. You can see in the bar chart to the right how most women had heard almost nothing or relatively little about genetic counseling, even though they should have been referred to counseling and testing. And you can see also below in the genetic testing referrals how very few had been referred to genetic testing, even though they met guidelines. You can go to the next screen, please. We found very promising findings in that after watching the video, women significantly increased the knowledge, intentions to participate in counseling, increasing favorable attitudes, positive emotions, they reduced ambivalence. We referred all of them to free genetic counseling, and 60% attended counseling, and from those, 82% proceeded with testing. If you can go to the next slide. In terms of acceptability, we found a very high acceptability. You can see here in the bar chart to the left, how among a scale from 1 to 10, most women rated the video from 9.5 to 10 in terms of their general satisfaction, how they found it interesting, how much they liked it, enjoyed it. You can see here in this code, participants saying, thank you, this video has helped me understand it, take the strength from that we can move forward with the obstacles and sickness. So the video was empowering and women felt identified with the video characters. They also suggested many ways of disseminating the video in the future, including social media, YouTube. You can go to the next slide. So unfortunately, this was a very small pilot with 40 women, but now we obtained a larger grant in which we are comparing the video with a fact sheet, and we are comparing it in a larger sample of 300 women in different sites, and we also expanded our community organization. So we're very excited to go for the next step of this telenovela video. If you can go to the prior one. Okay, so now I'm going to also share another intervention that our team developed. This was an adaptation of an already existing intervention that was a telephone genetic counseling intervention. And the idea was to do a cultural adaptations to also to enhance the use of genetic counseling and testing for Latina women. You can see here all our partners with Nueva Vida, Capital Breast Care Center, and yeah, you can go to the next slide. Thank you. So the rationale for this intervention was that there was a study showing that telephone genetic counseling was equally effective as in-person counseling. In the past, most of the sessions were in person, but they wanted to see whether doing counseling by phone was equally effective. This was a study conducted with almost 700 women, and they showed that telephone genetic counseling was safe, it was acceptable, it was effective, and it also reduced the cost. But the sample was mostly high-income, non-Hispanic white women who had self-referred to counseling. So our goal in the study was to see whether telephone counseling was an alternative strategy for Latina women, because it could reduce the cost, the logistic barriers like transportation, and also the language barriers. There's very few genetic counselors in the US who speak Spanish or who speak a language other than English. So if you do genetic counseling by phone, you're giving access to these very few Spanish-speaking genetic counselors. You can go to the next slide, please. So part of the adaptation entailed adapting some visual aids. When genetic counseling happens in person, the counselor often has a booklet with images that help them explain some of the concepts. So in the telephone counseling intervention, those booklets are mailed. However, you can see to the left in the original intervention, there were some visual aids that were hard to understand. If you think about, if you don't have a background in genetics, it's hard to understand that this is a family tree and that what is a square, what is a circle. So what we did was we hired a Colombian artist to create illustrations that could be targeted to our community. And that would allow us to have control over what we wanted to communicate. So you can see to the left, that is the adaptation that we made, in that we were able to do drawings and to present the information in a way that was easier to understand. You can go to the next slide. We also replaced complex genetic information with more basic definitions of the genes and heredity. You can see to the left, you have the original booklet that has the information with the chromosomes, genes, inheritance, and how we adapted it to present definitions about genes, also to stress like inheritance is like flipping a coin, because we had learned from our interviews that some women could feel guilty if they thought that they were passing a mutation. And we also use analogies like the flan recipe to explain the concept of mutations. You can go to the next slide, please. We randomized this study. We were comparing telephone genetic counseling compared to enhanced usual care. And we also had promising findings in that 9 out of the 10 participants in the telephone genetic counseling arm actually participated in counseling, compared to only 4 out of the 11 participants who were in the enhanced usual care arm. So again, we had promising findings. This was a very small study, and we're hoping to do a larger study with this intervention. But this was just to show a few examples of the culturally targeted interventions that we have developed in partnership with community organizations, and also doing a very extensive formative work to understand the needs of the community. Thank you so much.